Between 10 and 30% of adults deal with chronic bloating. Not occasionally, not after a holiday meal that got out of hand, every single day. The part that actually surprises people, most of them have already cut out the usual suspects. No cabbage, no beans, no soda, plain chicken, plain rice. The bloating comes back anyway. Something else worth knowing. The standard medical response to this, a drug that breaks up gas bubbles, doesn't treat the cause. It treats a symptom. That difference matters more than most people realize. If you want health explained clearly and without spin, subscribe and hit like. It helps more people find this channel. And the goal here at Dr. Waterling is 200,000 subscribers. You're part of making that happen. Practical checklists and health posts are on my Telegram. Scan the QR code on screen right now to grab them. The most obvious layer first, then the part almost no one talks about. The first reason food produces gas is purely biochemical. Your gut contains billions of bacteria, and that's not a problem. That's normal and necessary. Digestion cannot happen without them. But when certain carbohydrates pass through your small intestine without being fully broken down, they arrive in your large intestine intact. The bacteria there treat them as food. They ferment those carbohydrates. Fermentation produces gas, hydrogen, carbon dioxide, methane. That gas has to go somewhere, and it goes into your abdomen. The foods that trigger this most reliably are beans and lentils, onions and garlic, yeast bread, sauerkraut, radishes, and carbonated drinks. Combining large amounts of protein and starchy carbohydrates in one sitting can also push things in the wrong direction because those two food types require different digestive chemistry and slow each other down when eaten together in quantity. Yeast bread deserves a specific mention. Yeast is a living organism. It doesn't stop being active when you swallow it. It keeps working inside your gut. Cutting back on yeast-raised bread is often one of the fastest ways to reduce daily gas production, and it's worth trying before anything else. Beans are a more nuanced conversation. They're genuinely valuable. Plant protein, fiber, minerals. Cutting them out entirely isn't necessary. The issue is that beans contain oligosaccharides, complex carbohydrates the human intestines simply cannot break down on its own. Gut bacteria do it instead, and they produce gas in the process. The way to reduce that gas production is practical. Soak the beans in cold water for at least one night, ideally 24 hours. Pour that water out. A significant portion of the oligosaccharides leave with it. Then cook the beans thoroughly until they're completely soft. The softer they are, the less fermentation work your gut has to do. One addition worth trying, a small pinch of dried komu seaweed in the cooking water. Komu contains enzymes that further break down those problem carbohydrates, and research supports that this measurably reduces gas output from beans. Most people with chronic bloating have already done all of that. They've eliminated trigger foods. They're eating simply. The bloating still comes back, sometimes in the morning, before they've eaten anything at all. If that sounds familiar, the food is not the problem. The problem is how the gut itself is functioning. Think about it this way. Take the exact same meal and put it into two different digestive systems. In one person, it's processed cleanly, digested, absorbed, no gas. In the other person, that same meal sits, ferments, and produces bloating. One meal, two completely different outcomes. The difference isn't the food. The difference is the state of the gut that receives it. When digestion breaks down, what you're dealing with is enzyme insufficiency, not enough digestive enzymes being produced, and reduced intestinal motility. Motility is the ability of the intestinal wall to contract and push food through. When that contractile strength drops, food moves too slowly. Slow food ferments. Fermentation produces gas. Gas accumulates. So why does enzyme production drop, and why does intestinal motility decline? The answer to both comes from a basic principle of physiology that applies to every organ in the body. An organ functions as well as its blood supply allows. The brain receives inadequate blood flow. You get headaches, poor concentration, mental fog. The heart is undersupplied, stamina drops, rhythm irregularities emerge. The legs get insufficient circulation. They go numb, they feel cold, they tire on short walks. Apply that same principle to the intestinal wall. It needs a steady, strong blood supply to produce enzymes in adequate quantities to contract with proper force to move contents through at the right pace. Reduce that blood supply and every one of those functions degrades. Digestion weakens. Fermentation fills the gap. Gas accumulates. The structure that most commonly causes that reduced blood supply to the gut is something called visceroptosis, the downward displacement of the abdominal organs, the stomach, the small intestine, the large intestine, sometimes the kidneys and uterus, shifting downward into the lower pelvis. When this happens, loops of intestine press against other loops. Blood vessels running through the intestinal walls get compressed. The gut literally doesn't have room to contract with full amplitude. Circulation drops, enzyme output falls, bloating becomes a daily reality. There's a pattern that shows up in primary care that illustrates how quietly this condition develops. A woman in her early 50s comes in reporting daily bloating for 3 years. She's not overweight, she eats well, she's been prescribed simedicone, the gas bubble breaking drug, multiple times. Each course helps slightly, then stops helping. What her previous doctors hadn't assessed was the visible lower abdominal protrusion she developed over the same 3-year period. Not fat, she hadn't gained weight. Displaced organs filling the lower pelvic cavity. That's visceroptosis in a clinical presentation. What causes it? Several things. Weakened muscles of the abdominal wall and pelvic floor, which are the structural support system for your organs. Rapid, significant weight loss. When the fat layer that cushioned and held organs in place disappears faster than the ligaments can adjust. Multiple pregnancies and deliveries. A sedentary lifestyle. And age. After 40, the ligaments that anchor abdominal organs gradually lose elasticity, and this process accelerates over time. You can often recognize visceroptosis visually. If your lower abdomen protrudes and rounds outward, particularly the area below the navel, at a normal body weight, that is very often not fat. That is, displaced organs that have settled into the lower abdominal cavity and pelvis. Many people spend years trying to tone that area with core exercises and wonder why nothing changes. It doesn't change because the problem is anatomical positioning, not muscle tone or body fat percentage. One more link in this chain, and most people overlook it entirely. The gallbladder. Bile is not simply a fat-digesting fluid, though it does that. Bile is the ignition switch for the entire digestive process. When food enters the duodenum, the first segment of the small intestine immediately below the stomach, bile should be released into it at the same moment. Bile does two things. It emulsifies fats, physically breaking large fat molecules into tiny droplets that can actually be processed. And it activates the digestive enzymes produced by the pancreas. Without bile present, pancreatic enzymes enter the intestine but remain largely inactive. Digestion stalls, fermentation increases, gas builds. What disrupts normal bile flow? A gallbladder fold, an anatomical variation where the gallbladder is bent, restricting bile from flowing out. Bile thickening, when bile becomes viscous instead of fluid. Small gallstones or sludge, polyps. The symptoms that suggest bile flow may be impaired are a dull heaviness or occasional pain under the right rib. Bitterness in the mouth in the morning. Nausea after fatty meals, and feeling full very quickly when eating. If those symptoms are present, the gallbladder is worth investigating. An abdominal ultrasound is the standard first step, quick and widely available. On the nutritional side, bitter compounds are known to reflexively stimulate bile production and release. One option that comes up in clinical practice is a concentrated aspen bark extract available at most health supplement retailers for a few dollars. A course of several weeks is typical. Many patients report improved digestion and reduced heaviness within 10 to 14 days of use. Worth raising with your doctor alongside the ultrasound conversation. The core intervention, the one that addresses the root cause in most chronic bloating cases, is restoring proper blood flow to the intestinal wall by physically returning the organs to their correct anatomical position. This is not a breathing exercise or an abdominal massage. It is a mechanical correction of organ position, and the precision matters. Here is the exact protocol. Lie on your back on a firm surface, a floor, not a soft mattress. Place a pillow or tightly rolled towel under your pelvis about 4 to 6 inches thick. This elevates the pelvis relative to the torso. In this position, gravity begins working in your favor. The displaced organs have a directional pull upward. First, perform a maximum complete exhalation. Don't simply breathe out. Empty your lungs entirely as if you're trying to compress your rib cage as far inward as possible. When you exhale completely, the diaphragm, the dome-shaped muscle separating the chest cavity from the abdominal cavity, rises. The diaphragm is anatomically connected to the internal organs through ligaments. As it rises, it draws the stomach, intestines, and related structures upward with it. The fuller the exhale, the higher the diaphragm travels, the stronger the upward pull on the organs. Straightforward mechanics. Second, while holding that full exhale, actively pull your abdomen upward. Not just inward, but specifically upward toward and under the lower ribs. This creates an additional lifting vector. Third, cut both hands with fingers pressed together and slightly bent, shaped so the fingertips can grip the abdominal wall. Locate the pubic bone, the firm horizontal bone at the very bottom of the abdomen. Move just slightly above it, about 2 finger widths. Press your fingertips into the abdominal wall and begin slowly, steadily drawing the abdominal contents upward in the direction of the navel. The most important technical point where most people go wrong: do not lift your hands out of the tissue during the movement. Your hands need to remain engaged in the abdominal wall for the entire sweep, from below the navel's lower point all the way to the navel itself. Only when you reach the navel do you release. If you lift your hands halfway through, you lose the entire effect of the movement. Complete 2 to 3 full sweeps. Then place your fingers in the lower abdomen above the pubic bone. If the exercise was performed correctly, you will feel the fingertips beginning to sink into that area, a kind of hollow or free space where there was previously resistance. That means the intestine has shifted upward, and there is now actual distance between it and the pelvis. After the first sweep, it may be subtle. After the second and third sweeps, it becomes more definite. Perform this exercise every evening before sleep. The minimum consistent period is 6 months. Some people with significant displacement require a year or more. The ligaments that are supposed to hold the intestines in position do not rebuild their holding strength quickly. This is slow work, but it is real work. There's a case from internal medicine follow-up notes worth mentioning. A man in his mid-40s had been through 2 rounds of GI specialist consults, a colonoscopy, and multiple probiotic protocols over 4 years, all without lasting relief. After 3 weeks of this organ-lifting exercise performed nightly, his morning bloating had reduced substantially. At 3 months, his physician noted a measurable change in lower abdominal fullness. On examination, the tissue had shifted, the blood flow had improved, the digestion had followed. It's worth understanding the scale of what poor digestion actually costs the body. When the intestinal wall is undersupplied with blood and fermentation replaces proper digestion, proteins aren't broken down into amino acids in the quantities the body needs. Fats aren't properly emulsified. Fat-soluble vitamins A, D, E, and K aren't absorbed. Minerals pass through without entering the bloodstream. A person can eat regularly and still be functionally malnourished at the cellular level. Persistent fatigue, weakened immunity, deteriorating skin, hair, and nails, all of these can be downstream consequences of the same chronic bloating that most people dismiss as a minor inconvenience. It holds. It holds. If this gave you a clearer picture of what is actually happening in your body, subscribe and leave a like. That is how this channel keeps reaching people who need it, and 200,000 subscribers is the goal we are building toward. Grab the health post and practical checklists on Telegram. The QR code is on screen right now. Everything shared here is for educational purposes. Your situation is specific to you, and a real conversation with your own doctor will always give you more than any video.